So today we're going to talk about the essentials of an exercise prescription and the way that we can actually use exercise as a treatment and prescribe it to patients that we are working with as a form of medicine. And what we're going to have on our schedule for today is talking about some general training principles, and then also how we can apply those principles to what we call the FITT principle, which is a way for us to actually use a prescribed fashion in order to give exercise to our patients, and then also just cover some generalized exercise prescription guidelines. So when we talk about generalized training principles, the adaptations that we are trying to accomplish when we are exercising all has to do with overloading of the system. And this might be the cardiovascular system, the respiratory system, or it might just be the muscles that we are currently using during that exercise. And whenever we work these systems out and increase the workload to them, we create an overload onto the system that it's not accustomed to. By doing that, over time, we actually can begin to improve the capacity or the efficiency of either that muscle or that system. However, when we are looking at how long of the time is between each exercise bout, that becomes really key in trying to find out if we are actually going to progress in our training or whether we actually digress in our training. When we talk about progression and we look at the frequency, the duration, and or the intensity of the exercise that we're performing, we have to make sure that we are increasing it as our system starts to adapt to that exercise load that we are currently performing under. And that's for us to be able to continue the improvement and the growth of that system. We also have to look at the specificity of the type of exercise that we are doing, knowing that if we are primarily training for a bike race, it would be best for us to actually be biking for our training. And also if we were training for a marathon run, that we would be training by running. We wouldn't necessarily want to counteract those by doing other exercise performances unless we're trying to better the entirety of our body systems as a whole. We also have to realize that there are some diminishing returns that are involved. So for example, the more unconditioned a person is when they begin a training exercise program, the more potential improvement that they can have over time, and actually quite rapidly in the beginning, because you're starting out at such a lower state. As soon as you begin that exercise program, you actually will increase incredibly quickly all the overload and adaptation that is going to be occurring. However, if we start with a person who is already highly trained in whatever exercise that they are performing, it's very hard to make those improvements, and improvements come at very long periods of time from each other, just because the system is already so well developed. We also have the idea of reversibility, in which when we stop exercise, we can actually start to detrain pretty quickly, and that detraining actually occurs more quickly than the training originally set on at. So the idea of recovery and overtraining and detraining, if we look at the graph that's over on the left side of the screen, it's kind of showing what an optimal time between different bouts of exercise might look like. You can see where we start at the dot over on the left-hand side, and then as we actually overload the system, we actually break down the system just a little bit, and you can follow that along the graph. But then when we stop exercising and we allow for a good time of rest, we actually recover, and that is the period of adaptation. You can see that colored portion that's occurring above where the baseline began. Then we start to exercise again, and we will actually drop a little bit as far as breaking down the system, and then we will adapt, and we'll continue going on and on and on. And we can actually improve our capacity over time for exercise. However, if you look over on the right-hand side of the screen, what you will see is the example of when we're either overtraining or detraining. Overtraining is located on the upper right-hand graph, and what you see is that there's not enough time between exercise bouts. So we start at our baseline, we overwork the system to overload it, we start to adapt, and we see us go up on the graph. However, before we've actually had enough time for adaptations to occur, we are already breaking down the muscle again or breaking down the system again, and actually start to decline on the graph. But then as we stop our exercise and begin to recover again, we start to go through that recovery period and go up. But again, if we don't have enough time between exercise bouts, we just continue to spiral down until we actually are just overtrained and the system actually cannot keep up with the training that we are performing. On the bottom right graph, what you can see is the example of detraining, in which we start at a baseline. We exercise, break the muscle down, then we start to recover, and you can see us go up on the graph and actually see the adaptation that occurs. However, if we wait too long between this exercise bout and the next time that we exercise, we actually lose all of those benefits again and drop back down, and we start back over kind of at our baseline. So we really want to make sure that we are exercising with good time periods in between each exercise bout, with not too much time passing and also not too little time passing. So when we talk about ways for us to actually prescribe exercise to our patients, we need a way to be able to quantify it. Think about it when you take a medication. If you have a headache, you're prescribed a certain amount of ibuprofen to be able to take, usually 200, 400, 600 milligrams. And then it tells you how often you should be taking it, every 4 to 6 hours, and what type of a medication it is, and then how strong that dose is. And we have a way to be able to quantify it. The problem with exercise is when we start talking to our patients about how they need to be exercising, it's hard for them to put that into a quantification to actually know how to begin, how much to do, what types of exercises to be performing, and that's probably one of the leading causes as to why a lot of patients don't actually begin exercising just because their doctors tell them to. They actually need a lot more guidance than that. So the principle we're going to use is all based off of recommendations from the American Sports Science Academy and the American College of Sports Medicine. And it operates off the FITT principle, standing F for frequency, I for intensity, T for time, and then the second T is for type. When we deal with frequency, it's just talking about how often the exercise is performed. It's usually quantified in how many times per week. So you can say, I want you to be exercising, 3 to 5 times per week. Things to take into consideration when you're dealing with your patients is you have to take into consideration what their schedule is, what their work schedule is, what they do after work, and how they can actually fit that in. And they might be in a place in their life where certain days of the week you actually just cannot exercise because they're too busy. We also need to take into consideration what their risk of injury is. We have somebody who is incredibly out of shape. Starting them out exercising 7 days a week would actually probably cause a lot of damage to their system and create a lot of injuries because their muscles aren't used to it. So we need to make sure that we're starting at a level in which is actually healthy for our patient and doesn't increase the risk of injury. When we look at intensity, we're simply looking at the difficulty of the level of exercise. So how hard are they exercising? Well, things for us to consider when we're prescribing it is what is their initial fitness level. Somebody who is starting out at a really base level, who is very deconditioned, we're going to start them off very slowly with a very mild intensity. Versus if you take somebody who is actually very active, having them go out and performing low intensity activities will not really benefit their system very much. So we actually need to make sure we're meeting at their level or even increasing it. We also need to take a look at what their goals are. Are they looking at just improving their health, or are they trying to actually increase their fitness? If we're just looking at health, a lower intensity actually works quite well. But if we're trying to increase our fitness, we'll need to actually have more of a moderate to severe intensity or vigorous intensity. We also need to make sure that whenever we're talking about exercise, that it's something that the patients can actually do. So we want to make sure that they will adhere to the exercise and actually perform it. The harder it is for them to perform, the less comfortable it is, the more risk that's involved, the less likely that they're actually going to perform exercise for us. When we look at time on this FITT principle continuum, we're looking at just how long each of the exercise sessions last. Things for us to consider is their fitness level. Somebody who's starting out at a base level will have a hard time trying to exercise for a long period of time for any given time period. But somebody who's used to being active and is very well conditioned, we're going to need to start them at longer periods of time of exercise sessions in order for them to actually gain benefit from them. And again, we can look at their goals and finding out if this is a health-related goal or if this is a fitness-related goal. We also consider this when it comes to progression. It's one of the first things that we can actually increase when we're trying to progress the training program. And then again, looking at their schedule, we can't prescribe them exercising for 3 hours a day if that simply cannot fit into their schedule. So we need to make sure we're taking that into consideration as well. And then lastly, we'll be prescribing them a type of exercise, which is simply what type of exercise they'll be performing. Some examples would be things like walking, cycling, or resistance training like lifting weights. Some considerations for us to take into consideration would be, do they have any limitations? If we have somebody who has orthopedic limitations, such as weak knees, weak ankles, something where they have chronic injuries, having them do heavy exercise that is weight-bearing exercise like running might actually damage them and increase the risk of injury. However, something like swimming might be more for that type of an individual who is limited by those things. We can also take a look at what their goals are, and that goes back to kind of the specificity of things. If they're looking for generalized health, it would be really great for us to get a wide variety of different types of exercises, versus if they're trying to train for a specific competition, we would want to be focusing them a little bit more on the type of exercise that they would be performing during that competition. Also, we want to take a look at what they have accessible to them as far as exercise equipment. Something like going out and running, you just need a decent pair of tennis shoes and something, appropriate clothes to run in. However, if you want to take a look at somebody who's trying to begin resistance training and lifting weights, they're going to need either access to a gym or a set of weights at home or some exercise bands or something that can mimic that, which requires a lot more equipment. So we just need to know, starting with our patient, what do they actually have access to? And then also taking a look at the activities that they enjoy, because we do want them to adhere to our exercise plan, and we want to make sure that they actually are going to continue it, so they have to enjoy the activities that they're doing. So there's different types of exercise, categories of exercise that we're going to look at today. The first one we're starting with is cardiorespiratory fitness. So this is simply working the heart and the lungs and trying to increase our heart rate and actually maintain this aerobic exercise. It's a continuous bout of exercise that's rhythmic in nature, and it does use aerobic exercise potential in it, and it uses large muscle groups. Some examples would be things like walking, swimming, cycling. It'd be fine for us to actually do intermittent activities as far as starting an activity, doing it for a short period of time, and then picking that up later in the day. We'll take a look at how that timing goes. And then also cross-training is nice if we're trying to build up a whole system instead of just a specificity. And so actually using multiple modes of exercise would be great. And then also make sure to take into consideration the enjoyment that the patient or the client might have. Please keep in mind, whenever we're talking about exercise, that water activities can be a great option, especially for patients who have those orthopedic limitations, or if we're dealing with patients who have morbid obesity. When you talk about trying to get somebody who is weighing an extreme amount, several hundred pounds, getting them to go out and run is very difficult on the body, but doing something that can actually take some of the weight off of them, such as water activities, swimming, water aerobics, and such, it can actually improve their health quite quickly and can still produce those same similar results that they would if they were trying to walk or cycle, but actually with a lot less injury. So when we talk about our cardiorespiratory, as far as how often we should be performing this type of exercise, the recommendation is between 3 to 5 sessions per week. It would be great if we could alternate days, as long as the schedule will allow for that. So it's something like beginning at 3 sessions per week and maybe a Monday, Wednesday, Friday, or it could be a Tuesday, Thursday, and then either a Saturday or a Sunday. Whenever we're considering the duration and the intensity, just keep in mind, if we are going under 3 days per week, we get very limited adaptation. We get that detraining that occurs like we looked at on one of the first slides. However, it could be enough to maintain just some low or moderate fitness level, something for overall health. However, if we're going above 5 days a week, we need to look at the elevation in risk that can be occurring and how that might be disproportionate to the reward that they're trying to gain. However, it can be used quite effectively for somebody who is trying to compete athletically, and actually endurance athletes will train more than 5 days per week. But really, we have to make sure this is working up to a gradual progression. You can't start off somebody on an exercise plan at exercising more than 5 days a week. So really, when we're starting off, somewhere between 3 to 5 days per week is a good balance, and making sure that we're allowing for some recovery in between those exercise bouts. Now, when we look at intensity, sometimes it's hard for us to kind of quantify how hard somebody is working. There's two different ways for us to be able to kind of gauge that in our patients. One is called the talk test. And if your patient or your client is able to exercise and still continue on a conversation without gasping for air, that's usually a moderate level of exercise. However, we want to make sure that they're not able to sing. If they're able to sing, then they're actually performing slightly mild exercise, and it's not quite enough to reach the benefits we would be wanting. If they're exercising too vigorously with this talk test, they actually wouldn't be able to talk and complete the sentences without gasping. You would only get a couple of words out before you're trying to gasp for air again. So it's a good way for us to tell our patients, try to carry on a conversation, but don't be able to belt out into a song, to know that you're working at a good moderate level of intensity. You can also just use a scale of 1 to 10 of how hard the patient feels like they're working, with 1 being not very hard at all and 10 being an extreme amount that you don't think you could work any harder at. Adaptations that we're looking for to try and increase in health are usually found around the scale between 6 to 8, this somewhat hard to hard category. So if they can judge themselves to say, how hard am I working, and they're around a 6, that gives us a good moderate level. 8 would be considered more of a vigorous level, in which we're trying to get more rewards for the exercise we're performing. However, getting up to like the scale of 10 out of 10 is more of like your maximum exercise that you couldn't maintain if you tried to go for an extended period of time. Then when we look at cardiorespiratory exercise duration, we really want to be aiming for about 20 to 60 minutes of continuous or intermittent, about 10-minute bouts of exercise. So beginners will usually start with about 20 to 30 minutes at each time that they're exercising, and this is the 3 to 5 times per week. And if starting at the 20 minutes or 30 minutes in entirety is just a little too daunting for them, they can start out with 10-minute bouts, or you can give them instructions to say, let's have you go out, and at lunch I want you to walk around the block twice, and that takes 10 minutes, right? And then they come back home after work and they walk around the block again twice, and that takes another 10 minutes. And that they can actually build their exercise on top of each other throughout the day until they're able to actually do it in chunks of time that are all together, 20 to 30 minutes. Always think about a gradual progression and combine that with how often they're doing it per week with the frequency. And we need to make sure that we're just really looking for some individual responsiveness. We need to make sure that they're able to perform the exercise that we're prescribing to them, and that it's not too heavy of an amount of exercise for them. And when we deal with our duration, as far as how long we're exercising each time, when we talk about our progression from week to week, this is the first thing that we're going to change. So over time, we're going to start to adapt, and that 10 to 20 minute to 30 minute bout of exercise will actually become easier for us. As that happens, the first thing we want to do is actually increase that time period. So we'll add on about 5 to 10 minutes every 1 to 2 weeks for about the first 4 to 6 weeks. After we get up to about 60 minutes of continuous exercise, that's usually the maximum amount of exercise that somebody can really do with a daily schedule that will work for them, and then we'll start to increase the intensity as well. Now, this 20 to 60 minutes that we're looking for does not include the warm-up and the cool-down time period. So if we're going to do a longer bout of exercise, we need to make sure that we are increasing the body and the muscle temperature and the elasticity at a slower rate. So we're going to do that through our warm-up. By doing this, we also will decrease the risk of musculoskeletal injuries, of pulling muscles or breaking bones or spraining ankles. And it also decreases the amount that the heart is working, and it creates less of an overload that might cause some complications. So we kind of warm the heart up in that process as well. after we've completed exercise, and we don't want to just stop right there and then after completing moderate level of exercise, but instead we need to do some type of a cool down. And what this does is it clears our waste products and it keeps our blood pressure stable, and so that we actually won't end up fainting after a bout of exercise. So take about 5 to 10 minutes to kind of recover. Go from running down to a slow jog, down to a walk, and do that in a downwards progression like that, so that you can actually kind of get your body back to a normal resting period without just stopping everything cold turkey. So that was our cardiorespiratory type of exercise. We also have weightlifting or resistance training exercise that the American College of Sports Medicine recommends. For as far as the frequency goes, the recommendation is that we are lifting weights 2 to 3 days per week, and it'd be great to be able to split this up over the time period of a week. So maybe if you are doing your cardiorespiratory exercise on Monday, Wednesday, and Friday, then you could do lifting weights on Tuesday and Thursday, and then maybe even adding in a Saturday or a Sunday, so you have time to recover. It's also a good idea to try and split up your routine a little bit so that you're not working your, one portion of your body twice in 1 week, but maybe splitting that up a little bit to begin with until you can actually progress a little bit more. So for instance, on Tuesdays, maybe I would focus on things that would build up my arm strength, and on Thursdays, I would focus on things that would build up my leg strength. As far as the intensity, the intensity and the time, we set everything into the terminology of sets and repetitions. So repetitions is how many times that you will lift the weight at one given time period and before you will rest again. And then each time you do that set of exercises, it's considered one set. And so the idea is we would do between 2 and 5 sets of between 8 and 12 repetitions for most of the populations of individuals we would be dealing with. When we find out, or we want to determine how much weight we should be working with, what we can do is called a 1 repetition max test. Basically, it takes a look at, if I were to lift all the weight that I possibly could, what is the heaviest amount of weight that I could lift? And you find out what that poundage is for each individual exercise you would be doing. And then we can actually determine what our intensity level is based off of that weight range. So let's say, for instance, if I was doing a chest press and the most amount of weight that I could do was 100 pounds, then if I wanted to exercise at more of a moderate level, I would take 60% of that and I would be lifting 60 pounds. If I wanted to do a slightly more vigorous exercise of weightlifting, then I would go up to maybe 80 pounds. So that's just an example. And really, it comes down to whether we're trying to go for strength versus endurance. And when we want to go for strength, we actually want to be lifting at that higher level of weight, and so more around the 80% of our 1 rep max, versus if we want to go for long-term endurance, we'll be focusing more on the lower end of that range and dealing around the 60% of the 1 rep max. Also, beyond just lifting weights, something for us to realize is when we're operating within this 60 to 80% of our 1 rep max, it actually improves the health of our bones as well. So this can be great for women specifically who are heading into the menopausal age, in which we actually lose a lot of our bone mineral density. So lifting weights during that time period or throughout our entirety of our life can actually improve the health of our bones just through that lifting of the weights, because it actually puts stress on the bone as the muscle is being torqued and increases the strength over time. And then taking a look, we'd really like, as far as the types of exercises, we'd really like around 8 to 10 different types of exercises. We want to look at major muscle groups, doing things that are very functionable. So we don't need to do any really weird lifts that you would never do in a normal day. However, things like doing a bicep curl or a chest press or squats or, lunges, these are all things that we would do on a daily basis just by cleaning the house or lifting things to carry things for our job. So these are all different types of exercises that we could use. Calf raises, all of those types. Now, when we take a look at the technique that we're using, we want to make sure that we're giving a really good range of motion, because whatever we are exercising at, that is where our adaptation is going to take place. So we want to make sure we have a good wide range of motion when we're doing our lifts, and not just working a very small range of motion when we're moving our arms or our legs. We also want to make sure that all of our movements are very controlled in all of our directions that we're moving, in order to not produce any injuries from us lifting weights, and it also helps to develop all of our stabilizing muscles by trying to keep everything very controlled. Another key note when we're talking about lifting weights is to make sure that we are doing proper breathing. We don't want to hold our breath when we are lifting an extreme amount of weight. By doing that, it actually increases our blood pressure immensely. That if our normal blood pressure is around 120 over 80 millimeters of mercury, it can put it up into ranges that are above 300 or 400 millimeters of mercury for our systolic blood pressure, which is the pressure on our arteries when our heart is working. So we really want to be cautious of that, because that actually can cause a lot of problems with inducing heart attacks and specifically strokes. So good proper breathing techniques, not bearing down, not holding your breath when you're trying to lift those weights, and making sure that we are encouraging our patients to not do those activities as well. The other category of exercise that the American College of Sports Medicine recommends is flexibility types of exercising, such as trying to do stretches and movements. We always want to stretch warm muscles, which means, a lot of times when we are dealing with sports in the middle school and high school realm, they have us start stretching before we've done anything else for our activity. That actually can cause a lot of damage to the muscles, and instead we would like to have a small warm-up first before we start to stretch the muscles. So it's a good idea for us to actually use that warm-up that we're going to be doing for our cardiorespiratory exercise, and then we can choose to stretch our muscles. Or sometimes people will actually wait until the exercise is completely performed for that day and then stretch as a cool down, which both work extremely well. However, whichever you do, flexibility is really important, so we still need to stretch no matter where we're putting it in, either after a warm-up or after the exercise is complete. As far as the frequency goes, the recommendation is between 2 to 3 days per week, or if you can, with each exercise session, spending a few moments doing it. As far as the intensity and the time of exercise, we're looking for just a gentle stretch. We don't need to try and be learning how to do the splits or anything, but just something that can stretch out the muscles that were just used in the previous exercise session, holding it for about 15 to 30 seconds for each stretch. So maybe looking at a total of 10 minutes of stretching. Each different stretch you want to do, you'll do it about 2 to 4 times so that you can get a good stretch to those muscles. As far as the types of stretches we want to do, the major muscle groups of whatever we were working out would be great muscles for us to stretch, and we should be moving in a dynamic fashion, so no bouncing or jolting of our stretching, and even static stretching is not really seen as good as if we're using it in more of a dynamic fashion. So think of things like stretching through a motion, think of yoga movements, and that actually has been shown to be the most beneficial to our body. It's also important for our range of motion and for us to be able to function to the best of our ability, and also to prevent injury. So that's all the different reasons why we want to make sure that we are stretching. And then again, just make sure to avoid any ballistic movements, or if you're experiencing any severe pain when you're stretching. Pain is not a good thing when you're stretching. You just want a gentle tug to all of the movements that you're doing. The final category of exercise that the American College of Sports Medicine recommends is what we call neuromuscular exercise. And it's things that require balance and agility and trying to create this connection between the body and the mind and this coordination aspect of things. We can call that proprioceptive training. So as far as the frequency goes, we're looking at 2 to 3 days per week. We want the intensity level to be very low to moderate intensity, nothing that's too vigorous. The time of this type of exercise, anywhere between 30 to 60 minutes when you are performing a bout of exercise. And good examples of types of this exercise would be things like yoga, Tai Chi, Pilates, or even dance movements. You can also do things when you're dealing more on the sports end of it, is agility training and balance and coordination. This is important for us throughout the entirety of our lifespan, is trying to make sure that our body is healthy and that we're able to control our movements well. However, this comes especially in need for our older adults who are at high risk of falls. And actually, by introducing them to the different exercises like Tai Chi or yoga and these different balancing activities, it can actually decrease their risk of falls and in turn actually improve their health. So this is another component of exercise we'd like to make sure is working into our patient's schedule. So just some thoughts. We've kind of taken a look at what the guidelines are and the principles of an exercise prescription. That gives us a solid foundation to work from. However, just realize that we can adapt this to different populations that have different needs. And so we need to make sure that we're always taking into consideration the individual patient or client that we're working with, and make sure that we're coming up with an individualized plan specifically for them. There are certain conditions, health conditions, heart disease, chronic obstructive pulmonary diseases, some of our respiratory diseases, or diabetes, in which certain exercises we might want to increase or decrease just depending on what's happening. So for instance, with diabetic patients, we want to make sure that we're keeping it at a low enough level that we're not increasing blood pressure too much, because we can actually have a lot of negative consequences of the health of our eyes and the health of our kidneys if we are exercising at a level that we increase our blood pressure too rapidly for our diabetic patients. We also need to make sure that we're keeping our exercise prescription and plan a dynamic process, meaning that we meet with the client, we might prescribe them the set of exercise, and then we need to check in with them and find out how that exercise plan is going. So if they are performing well, we need to make sure that they are progressing in their exercise, so adding time to that duration of how long they're exercising each time, and then also adding into the intensity once we've kind of gone to the maximum level of time that they're willing to put in each day for an exercise. And then also making sure that if they're coming back and they're not performing their exercise, to find out, is it too hard, is it too much time, what do we need to do to adapt the program, and try to negotiate a way through a good program for exercise that they will adhere to and still reap the benefits that we're hoping that they will.